Now let me introduce the next speaker, Dr. Farzad Salehpour from the University of Texas at Austin, USA. He's a researcher assistant, and also he's working in the field of neurophotobiomodulation, and also he's a co-author of the book by title of Neurophotobiomodulation and Neuroscience. Dr. Salehpour, please just start
Hello.
your talk.
Hello, everybody. Can you hear me?
Yeah, sure.
Absolutely.
It's fine.
Thank you so much for having me. Such a great pleasure to be here. So today I'm going to talk a little bit, like briefly, about the application for the ADHD, but because of the time limitation, probably it's going to be like very quick. I will be happy to answer some of the questions that people can have, especially on the neurodevelopmental part of the application. Let me start to share
Thank you.
the. Can you see the slides?
It's fine. It's okay. I can see.
Okay. So how about now? Can you see full screen?
It's fine.
Very cool. Okay, so the transcranial photobiomodulation therapy for ADHD is a kind of unique and very novel techniques that you can see in the literature these days. And then just recently, I think that was last month, the people from, I think, China published the repeated session transcranial PBM in ADHD participants. So that's such a great pleasure that we can see some sort of development in the field. So today I'm going to talk a little bit about the potential application of this technology in the neurodevelopmental, like ADHD, that we can also extend it to the autism spectrum disorder as well. But probably I'm going to skip these slides because of the time limitation, but I can give you some digest what is going on here. So in terms of the pathology, let me tell you in terms of the broad like perspective. Photobiomodulation has some of the limitations because of the penetration and some of the applicability. For example, in terms of the brain, we have the transcranial application, which has these limitations, to be honest. But some of the pathologies are kind of good candidate for seeing some of the results, even with these barriers and limitations. For example, those pathologies that most of the pathology is focused on the prefrontal cortex, we have a good chance because we don't have any hair on the forehead, and then mostly you're going to see more than 80% of the like PBM application in the brain disorders are focused on the transcranial of the forehead because of the hair. So depression, ADHD, and some of the other psychiatric conditions are getting advantage of that particular, the targeted PBM thing. ADHD mostly is believed to be involved, like the pathophysiology of the ADHD is believed to be involved with the right prefrontal cortex. I'm not saying this 100%, but most of the studies shows that hyperfunctionality in the right prefrontal cortex, as you can see, and then the connection, like network between the dorsolateral prefrontal cortex and parietal network are involved with this response inhibition and impulse control problems that people have. And also another network that is involved with ADHD is the medial prefrontal cortex, like from our frontal cortex into the some of the deep structures like limbic structures or nucleus accumbens and ventral striatal networks. So PBM over the forehead can have a chance to stimulate these networks. That's why one of the reasons that probably we can see good results for depression and anxiety, that some of the research is coming up because of this superiority of the transcranial over the forehead. So, but what is the action mechanism of PBM? I'm going to go through this very quickly because some of the colleagues covered this already. PBM from 600 nanometer, like red light, to 1100 nanometer near infrared light, have a chance to stimulate the mitochondrial inner membrane enzymatic complexes, particularly enzyme number 4, which is cytochrome C oxidase. So with photooxidization of this particular enzyme within the mitochondrial inner membrane, we have a chance to increase the ATP production and also increase the oxygenation of that particular biological media. It can be like muscle cells, can be neuronal cells, and etc. Our lab at the University of Texas at Austin was the first to show the action mechanism in vivo in healthy people of laser stimulation, like 1064 nanometer, over the forehead for the first time back in 2017, that showed that 8 minutes of low-level laser therapy can significantly increase oxygenated cytochrome C oxidase concentration on the frontal, like prefrontal cortex overall, as you can see from the second minute of the irradiation, and then follow that from third minutes, they showed some sort of increase in oxygenated hemoglobin concentration as well. So this paper, Wang et al. Paper, is the foundation of all of those human brain PBM studies back in a decade. So in healthy people, also we did the meta-analysis back in 2019, and particularly on the attentional domain of the cognitive aspects, transcranial photobiomodulation has a chance to improve these outcomes. I mean, particularly for the attention domain, the results were homogeneous. A standardized mean difference of 0.83, which is a good effect size. So, and recently from our lab, also we showed that transcranial bilaterally to the forehead with particular parameters that I will explain it in detail, can improve the oxidized cytochrome C oxidase and differential hemoglobin concentration as well, as you can see. But there's a gap between the cytochrome C oxidase increase and then differential hemoglobin, because these are people are bipolar with older adults with the bipolar disorder. So because of the lag between the neurovascular coupling issues that people with elderlies with bipolar has, we see that the increase in oxygenated hemoglobin has a delay compared to the cytochrome C oxidase, like compared to the healthy people that I just showed in the previous slide. So with respect to the light penetration, there are a lot of debate going on in this particular field. Like some of the simulation computational modeling says, okay, 810, 850 is better than 1064. But recently, our group also showed some sort of mathematical modeling showing that 1064 is better than 810 in terms of penetration because of the low absorption by hemoglobin and melanin and lower scattering compared to the 810. And also previous research back in 10 years ago from our lab in human post-mortem brain showed only 2% of 1064 can reach frontal cortex, like into the cortical surface. And this is almost true for most of the near-infrared light. For example, 810 has probably something between 1 to 2%, something like that. And also one of the other advantage of the using 1064, compared to the 810 would be having the much higher maximum permissible exposure for the skin, which is almost 3 times higher than that, which means that we have a more window to increase the power density without having any damage to the skin. So let's go with some of the hypothetical, presentations. So as I mentioned, ADHD, attention deficit hyperactivity disorder, is characterized by the impaired attention span, and also response inhibition is impaired in those people. So one of the targets that we want to radiate light is either right prefrontal cortex or left. That's a big question. But our meta-analysis back in 2019, and most of these studies that these days you can see, show that right prefrontal cortex is good target for improving attention and attentional processes and cognitive control in general. So because we do research on the FNIRS, functional near-infrared spectroscopy, I have provided some of the methodological slides for you, but I'm not able to present the results from our study, but probably you can get the idea of what is going on. So radiation of the medial right and medial left, I'm gonna show you the medial lateral, sorry, the medial right prefrontal cortex and lateral right prefrontal cortex is the treatment protocol that we're trying to establish for people with ADHD. So why medial prefrontal cortex? Because with this medial, we're going to see some working memory and problem solving issues with these people because they have a problem with impaired decision making, impulse decision making, let's call that. And also working memory is one of the other components that these people are struggling. So the lateral right prefrontal cortex is another target. Particularly, this target is more interesting because all of those response inhibition and cognitive control are concentrating in this particular region. And as you can see, this lateral side can be divided into two even distinct regions, like 44 Brodmann area and Brodmann area number 45 as well. The 44 is involved more in this action inhibition, and 45 is involved with this, inhibiting socially inappropriate behaviors that people with autism and people with ADHD probably have social deficits because of these problems, apparently. So also with right prefrontal cortex irradiation, we have a chance to stimulate this particular region with this particular treatment protocol. So the treatment protocol would be 1064 nanometer laser. I mean, this is not exclusive. You can use 810, 850, whatever. But as long as you use near infrared, not red light, because red light has a probably less than 0.1% of chance to get into the cortical surface in terms of the brain application, like transcranially. So, and then with the irradiance, like 250, 200 milliwatt per centimeter square, these are enough. Like anything above 100 milliwatt per centimeter square would be enough. And also because if you decrease the irradiance to 100 milliwatt, then you have to increase the time to get that particular fluence. That is, optimum fluence would be 60 joules per centimeter square per site. So this is a well-established protocol, back in, I think that was 2009, Friedrich Schiffer from the McLean University Harvard Medical School established this particular protocol for a brain, and then getting that 60 joules per centimeter square needs 250 milliwatt and times 8 minutes. So 4 minutes lateral and 4 minutes medial would be enough to get that dose. And with that, we're going to cover Brodmann areas 10, 46, 45, and 44, as I mentioned. And then we have a chance to improve some of the symptoms. So as I mentioned, we're working on the adults with ADHD with single session stimulation and repeated session stimulation, and hope we can publish the paper soon. And then I'm going to present the published data someday. I would be happy to do that. Okay. Again, I would rather prefer just answer the questions if you guys have, and thank you so much for your attention.
Thank you very much, Dr. Farzad, for your nice presentation. Thank you for sharing your upcoming results of your new project about the 1064 wavelength. It's interesting for me, actually. Any question? Is there any question? You can.
Hello, Dr. Farzad. I hope you're doing well.
Hi.
Okay.
My question is related to this ADHD protocol. Do you think that there would be any side effects that you might have encountered if such a therapy is performed in children, especially, we tend to actually manage ADHD in children more than adults, right? So do you think we can encounter any side effects, because child brain is still is growing, right? So do you think there could be any side effects to that?
Okay, so based on the literature, there's no study like randomized clinical control study in children and adolescents with ADHD. Our study is the first in adults with ADHD, and we're about to publish the data, hopefully. So I cannot say anything about that. Even with the autism spectrum disorder, you're going to see some of the papers coming from the Harvard and New York University group, and then there's a cautious regarding the application for the children. To be honest, even adults, these research are very new. I mean, it's not depression with more than 10 randomized clinical trial. This is the ADHD with 1 or 2. So more research is needed, to be honest. Yeah, especially using the laser. If you use the LEDs, then it's going to be a little bit different, but it's still, it needs more randomized clinical trials.
Thank you.
Absolutely.
Dr. Salehpour, how are you doing?
Hello,
I'm Reza
Dr.
Farzad.
Yeah, absolutely. Great.
I was very happy to see you again after several years ago. I follow your activities in the cooperation with Paolo Casano and Michael Hambly. I know you are in the right way, and I'm always waiting for your successful activity all around the world. I want to ask you questions about which type of the mode of radiation did you use in this 1040-64 in continuous mode or pulse mode? And the second one, is there any comparison between the different wavelengths, such as 810 and 918, and also 1064? I remember several articles compare between the 810 and 918 wavelengths. It's not the penetration is the important part, because of the cell maybe has a different response to the 810. I remember 810 wavelengths is used better than 900. Do you have any comparison between the 1064 and 810 nanometers for your studies?
Mm-hmm. So the first question, we used continuous wave, like Gonzalez-Lima likes continuous wave, and we haven't done anything like pulsing, to be honest, in our lab. So when with respect to the wavelengths, selection, in terms of the clinical practice, I think, okay, we have two different aspects. First is the penetration, second is the absorption by the particular photoacceptor. In this case, the cytochrome C oxidase is involved. So depends on the action spectrum for absorption of the cytochrome C oxidase. We're going to see that the difference are not huge. I think the most of the contribution goes to the penetration. With that said, then we're going to say probably anything above 800 can have an impact in terms of clinical practice. I mean, in vitro, you can see that, okay, the cytochrome C oxidase 10% more or less in that particular wavelengths. But with respect to the symptomology of the patient and participants, like hemodynamic response, anything like that, probably it doesn't matter, to be honest. Anything about 810, but it's still 970, 980 is not good, because there's a water peak absorption, and also some of those, you're not going to see 800. You're expert in this. I mean, I don't have to say these, but 1064, 800, 830, 850, and 870, these are good in terms of penetration to the brain, but you're going to see some of the advantage and disadvantage for these wavelengths. As long as,
yes.
As long as you select the good parameters, like good parameters means the power density would be enough, like irradiation time would be enough. If you want to target 60 joules per centimeter square fluence or energy density, and then for doing that, if you deliver like 100 milliwatt per centimeter square over like 600 seconds, okay. But if you want to deliver that over 10 milliwatt per centimeter square over 6,000 seconds, it's not going to work, because the The dose rate is important. A lot of factors are important in addition to the selection of wavelengths in PBM, to be honest.
Thank you for your answer. I would like to know your idea about the, we have the problems with the penetration of the light in the brain because of a skull, the bone, and something like this, especially in deep part of the brain. And we can use in the noise and in the palatal part of the mouth. And I would like to know your idea about the intravenous laser therapy. Maybe we irradiate transcutaneous carotid and something arterial and affect the component of the blood and maybe increase the success rate of the our topical transcranial irradiation. What's your idea about this?
Yeah, absolutely, definitely it can be. Even not transcranial, you can cover like through the, cover over the skin like carotid arteries. These are some of the protocols that people like John Mitrofanos is using for Parkinson's disease. That's very helpful, to be honest. Yeah, absolutely. Anything that you can irradiate the blood, either through intranasal application or through carotid, as you mentioned, these are successful, I think, treatment protocols because we have a lot of, floating mitochondria platelets and things like that. This mechanism is fascinating, to be honest. It's underexplored.
Yes, in the Russian, in the Russian concept, they use in the angiocat in the directly to the blood, not transcutaneous, but directly irradiate the blood in the injection with the angiocat in the artery, and maybe we can get good results than transcutaneous. In transcutaneous, we lost the majority of photon energies. Maybe we can use in the future working in intravenous laser therapy than transcutaneous laser therapy. I would like to mention this part of the Russian concepts. They use this form of the blood radiations, directly blood radiations for using in, for example, I remember I have a presentation several years ago about the photobiomodulation in the sport medicine. I saw interesting terms, light dopings. Is it important because the Russian athletes before the Olympic Games use these forms of the radiation in the blood and increase the ATP and increase the body energy, and they can increase the function of these athletes in the Olympic Games. This is a very interesting thing. We cannot find this effect in the body. In the chemical doping, we can test the blood and they can see some markers in the blood, but in the photobiomodulations doping, we cannot find any things in these forms. Just I would like to mention interesting things in terms in the sport medicine. Thank you for your excellent presentations.
Absolutely. Thank you so much.
I have also a question. What do you think about the combination use of the, for example, two wavelengths together? For example, 810 nanometers, and also combination with what do you think? Maybe we can find some kind of synergy, and it's a better result.
Okay, so earlier I mentioned wavelengths are important, but not as much as like penetration. But here's the thing, like more clarification, like 810 probably has more action absorption by the cytochrome C oxidase compared to the 1064, but apparently 1064 can have some other mechanisms on the water molecules located within the like membranes, like cell membranes. So for different wavelengths, we have a little bit different kind of mechanisms that we can consider that. I mean, let's forget the penetration matter, but with respect to the action mechanisms, probably yes, wavelength. The studies show that some of the ion channels, based on calcium ion channels or activated through, I don't know, 940 nanometers and things like that. So combination would be suggested, but first it needs more research and animal research. In vitro, it's okay, but mostly preclinical animal research needs to be improved.
Okay, thank you very much. Thank you for your explanation. Is there any question?
I would like to ask about the most of the all of the maybe speakers may try to answer, or they have some opinions about that. The effect of the photobiomodulation to brain waves. For example, we know that there are types of brain waves, and for example, in patients with, for example, dementia, moderate dementia and severe dementia, the brain gets slows and uses more theta, delta, etc. And also for example, in patients with ADHD, patients use some types of ADHD, electrophysiological subtypes. They produce more theta, some subtypes they produce more beta. And for example, if you have a patient with ADHD having more theta in the frontal lobe and maybe related with some symptoms, and or less theta, how would you like to interpret photobiomodulation? For example, trying to enhance theta or diminish theta by supplying theta, or for example, theta is low and I should try to increase the power, so I must apply beta. Do you have any opinion about that? And also, photobiomodulation is used not only in neuropsychiatric disorders, in skin disorders, in different disorders with different laser properties, different frequencies, different spectrum also. And the gut is very important for neurological disorders such as dementia, Parkinson's disease, autism also, etc. Can we apply photobiomodulation, for example, to the irritable bowel syndrome, or to the gut of the autistic patients, for example, putting the diodes on their belly? Thank you very much.
Absolutely. Yeah, you mentioned a couple of good things. So in terms of the what is impact on the brain rhythms, so there's a paper from Gonzalez Lima's lab. I think that was 2019. I can send it through the group that you're gonna see some dose response and curve for the increasing dose, and then you're gonna see impact on the EEG frequency bands. I'm not expert on the EEG, to be honest. I can send you some of the papers from this group that shows that, as you mentioned, with increasing, we're going to see different impact on the EEG. But the thing is, you mentioned some systematic, abdominal application for the brain, for the people with autism that can be. For the abdominal application, these research are going on right now, and then also our lab is doing something related to the autism with that systemic application of the PBM. So, okay, here's the thing: any medical condition related to the metabolism has a chance to be impacted, has to get benefit from PBM. Because of this ATP production mechanism that we mentioned. Once photon from any light, like red to near-infrared light, can hit the cytochrome C oxidase, the first thing will be the pumping the proton into the membrane, and then you're going to see the increase in the electron transport chain. And then with that electron will be absorbed by the oxygen. And then in this process, the cell will call, we need more oxygen. You're going to see more cerebral blood flow in terms of the brain, and the eventual thing will be the increase in ATP production. So with this ATP, you're going to see, okay, when you're saying the electron transport, like oxidative phosphorylation, absolutely you're going to see some of the ROS, was generated during that particular thing. And also sometimes ATP is a secondary messenger. And then through this, you're going to see secondary events, the cascade of secondary events. So apparently metabolic conditions are good. This can be like gut-brain axis problem with autism, dementia, Parkinson's disease these days. You can see that. Definitely that can help. Actually, I have the path for the abdominal application that you said. So this is the new research, to be honest. I mean, red light systematically over any bodies, like it could be skin, it could be like on the muscle. That's a great idea. I mean, abdominal application is fascinating. I use it every day for myself. So yeah, I can be like Case.
Thank you very much.
Thank you again, Dr. Farzad, for very good actually explanation, actually. And thank you again for all participants for this discussion, gathering together and having this time. And if there are any questions, we can exceed our session for example, 5 or 10 minutes again. If you have a question from the other speakers also, you can ask. You can just turn on your microphone and share your question.
Can I have a comment to our colleagues from Pakistan about the dentist? Because as a periodontist, I heard about the questions from our colleagues from Pakistan about the green wavelengths to the oral maxillofacial regions. We don't recommend this wavelengths because of low penetration in the body, in the muscle and maybe in MPDS. And also, we are working now a lot in the IAN injury after implant insertion or third molar extractions, and also in some trauma from this area. We strongly recommended 810 nanometers with 12 joule per centimeter square. Because of this 530 nanometers lasers is not useful for these problems in the oral maxillofacial regions. We strongly recommended 810 nanometers. And if you follow our group articles in the PubMed with my name, Farzad, you can find several articles and also some systematic review in these fields. And you can find some more information about this. I hope can answer your questions about this problem.
Thank you, Dr. Reza. Just one thing, since you mentioned about the wavelength or the recommended wavelength, you just said above 1,000. Do you think this is also the applicable range for treating myalgia? And I would like to ask the other speakers as well, related to myalgia and superficial pain, something like that. This is
yes, please. Can differ to the two problems, because we have the pain, and another thing is we want to regenerate the nerve in such as neuralgia and something like this. We recommended high joule per square, for example 40 joule per centimeter square. I recommended for neuralgia, and the pain management is a different form. If we want to use for generation of the nerve injury, we recommended low energy density and power density less than 8 to 12 joule per centimeter square. There is no systematic review about the myalgias and something like this. We need more clinical trials in the futures, and because of the very lack of patients, we can not reach to the evidence-based recommendations. If you're familiar with World Association for Laser Therapy, we're working in the recommendations in the World position paper. Currently, we publish in stem cells recommendations. As before this one, we send out in the cancer supportive care in the group, big group, and if we have a chance in the next month, maybe we accept our articles in the world position papers in all aspects of dentistry. Maybe in the futures we can publish these articles. We gathering a big group, more than 41 scientists around the world, about this position paper. But this area is a very rare cases, and maybe we can not do clinical studies in this field. Because of this, we cannot give you exact protocols. You know, in the oral mucositis after chemotherapy and radiotherapy, there are a lot of risk clinical trials, but we cannot powerful and the exact protocols. In this way, we can try the other clinical trials in future. But in this way, we maybe recommend in the in my own experiences, I recommended for myalgia and pain, we use the 8-10 nanometers and the 30 to 40 joule per centimeter squares in each area in the 1 centimeter squares. And but if you want, I give you exact protocol. I cannot answer you. I hope I answer your questions.
Sorry, Dr. Farzad, we cannot. Okay.
I finished my speech. I'm waiting for the Miss Najia.
Thank you so much, sir. Thank you so much for your detailed answer. I really appreciate that.
You're welcome.
So, Dr. Mariam, I have a question.
Dr. Farzad, just is there any question we can?
Yes, I have a question, Dr. Mariam.
Sure.
Can I?
Yeah, go
So
ahead.
this is Kuratulan from Pakistan, and
Welcome.
my question was basically related to the epilepsy, and it was mainly to the Dr. Soraya. I think she left. So any other participant who can answer it. As we all know, the current mainstay treatments for the epilepsy include both medical and surgical options. But provided with that information, 30% of cases have an ineffective
Excuse me, Mrs. Goratol. Just could you repeat your question, because we actually we don't have, we didn't have your.
Okay, wait. So now you hear me?
In
Do you
the
hear me now?
Sorry, in the literature, it's told, yes, it can be used in epilepsy, but
yeah, it's about
epilepsy. I haven't used.
So I want to know that that's photomodulation therapy is how much it is effective for the treatment of epilepsy, and is it really safe? And as Dr. Soraya mentioned, the mitochondrial dysfunctions is the main reason for the neurodegenerative disorder. Similarly, it is happening with the epileptic pathophysiology. So how much safe is this neurotherapeutic strategy for the epilepsy? So anyone who can answer this question.
Actually, as I know, the epilepsy is some kind of some country. You know that some epileptic people, it's very sensitive about some kind of every kind of pulse, maybe, and so maybe, and but I think there are some research, and mostly clinical research by about the using PBM for the epileptic people, and but I think there is no still a clinical to start with this kind of study. But other speakers or lecturers, if you have any comments, please. And let me maybe some people have no familiar about the photobrain laser therapy device. Just let me show you just a little bit, just maybe 2 or 3 minutes about this device, that how does it work. This is kind of the devices, but using that made in by Insightsprism company. It's located in Iran, Tehran, and just can you see the slides correctly?
Yes, yes, we can see.
Yeah. As you have seen this picture, you can see this device has a unit control, and also it has 8 laser probes. Each laser probes has have the 810 nanometer wavelength. I mean the infrared wavelength. As you have heard from all speakers, that this wavelength is very good penetration, and recommended from the many literature that this wavelength is very good for PBM in the brain disorders. And this device enjoy a silicon cap designed by a Stan 1020 system. As you know, it's the EEG compatible system that you can set each probe based on your desired protocol. That it's depend on the actually diseases of your patient. For example, maybe for depression, you use for example, FP1 and FP2, or F3 and F4. But for example, for some another disorders, for example, for Parkinson, you can use CZ or FZ, and it's you can change the position of each probe, and also you can switch off or on 2 probes, 2 laser probes or more. For example, 4 laser probes or 6 laser probes, or full of laser probes. I mean 8 probes. You can montage or set the whole places, the scalp of your patient, and after that you can set the power and frequency of laser by changing the parameter in the unit. In this device, you can actually set the frequency of pulse. For example, this frequency compatible with the EEG frequency band. I mean that from the theta wave or delta wave up to high gamma wave. I mean, you access to, for example, 3 hertz, 4 hertz, 5 hertz, and also 10 hertz, etc., up to 100 hertz that you can set, depends on your patient. And also this device, because you can change the number of active probes, and also you can change the dose of energy. I mean, you can change the power of delivery that you want to deliver. I mean, the power of each laser that you want to deliver to the patient. And also you can set the time duration, and at the end, the dose of energy that it's called expressed by the joule per centimeter square. And you know that the joule parameter is very important when you are dealing with the photobiomodulation therapy. And this device is very good suggestion to initiate any actually study project, clinical or preclinical project, if you wish, because there are a lot of parameters that you can set based on your project. There are many evidence that a large number of clinics in Iran nowadays using this device for project study. And because of the lack of time, I ignored them. And after that, I will share you this PDF in the groups. And just I will show you the animal model of these devices that you know that you can start many animal research on the rodent or mammal research. But for rodents, because you know that the rat is very low weight and you have to use a very small and tiny probe. And because of this, a company actually initiated and made a special probe for this kind of study project, but different wavelength, a large wide of the wavelength is accessible. So now, just thank you again for your contribution and attention for this talk. And again, thank you again for all the speakers that come together and accepted my invitation. And thank you all of you to come here and this good discussion. If there are any question, we can ask. Just let me invite all of you, if you have run any new project in your institute or university in around of the world. As you have seen, many participants from different countries, Pakistan, especially India, Nigeria, Indonesia, Malaysia, and other countries come together here, and this is very interesting for us. And if you want to initiate a new project with us, our group, with our institute, and also with Dr. Mehrabi in Iran Medical University of Iran, you are welcoming. It's a very good news for us. Thank you for all of you. Thank you very much. If there is no question, we can finish this session. And we hope to see all of you for another session. And as you know, the photobiomodulation is a very, actually, very big topic, and it needs more sessions, maybe a whole days, and maybe a full school to more discussion about this topic. And just this webinar, we wanted to give you a sense or just give you a hint about you can use this kind of non-pharmacological approach for maybe the treatment of brain disorders and maybe initiate some new project study. Thank you again. I do appreciate it for all of you.
Thank you so much, Dr. Mariam. It's really amazing and it's very informative topic. Thank you so much.
Thank you, all of you. Thank you for your coming.
Thank you, Dr. Nurbakhsh. Thank you very much.
Thank you, Dr. Farzad, for your coming and very good discussion. I'm very glad to my old friends, Dr. Zahra Batul here also, and some of my Pakistani friends in the ICCBS University in Karachi University.
Yes, absolutely. We met there in ICCBS, and that's why we joined here.
Yeah.
Right post-COVID, pre-COVID time, and that was really amazing experience with you people.
Sure. It's a very interesting time, so for me it was. So thank you very much. Let me finish this session, and Khuda Hafiz, goodbye.
Khuda Hafiz, Allah Hafiz.